My name's Andrew Boyd, I'm a GP and I work in London, and I was an IGH fellow back in 2011-12, and I went to Battambang in Cambodia, and my main project there was about hygiene and sanitation improvement there, and I now work for the IGH team as a senior fellow, and I'm the lead for leadership and education. The Improving Global Health programme is a unique programme, I think, which allies both leadership development, which is vital both in the NHS and in healthcare overseas, with an overseas volunteering experience. The IGH Improving Global Health programme is a really fantastic, unique opportunity for people who work for the NHS in any one of a number of roles. You can be a doctor, a nurse, a manager, and it gives you the opportunity to develop your personal leadership skills, which are really vital for the NHS to move forward and to survive, to be honest, with working in an overseas healthcare resource poor setting. I'm an ideas person and I find it quite easy to come up with great ideas for things, but the reality is that if you're going to implement them, there's many steps you have to go through for that to be successful. And I was involved in a kind of innovative sanitation and hygiene project that I'd come up with some of my overseas colleagues. But to implement that successfully, there's a lot of hard graft you have to go through to get to that point. Getting other people on board, so engaging other people to be enthusiastic about it, going to lots of meetings because it has to have buy-in from government and local people as well, and finally sort of budgeting and planning for it successfully. I certainly came back from my placement with a whole host of new and developed skills, and many of them have been really relevant to my clinical work. I think particularly problem solving, not necessarily with the patient, but around systems that improve the patient journey. And I know some fellows who have also returned who have really had quite a sea change in their thought. They consider themselves clinicians, dyed-in-the-wool clinicians, if you like, and after their fellowship they've seen the light to an extent, and they've realised that really you can't just be a good clinician just by being good with your patients. You also have to look after the whole system and the teams that you work in and communicate with the people you're working with as well as the people you're treating. And I think that ability to see a problem and problem solve and tackle it is really valuable for ongoing patient care. I'd recommend applying to the IGH programme for anyone who works in the NHS who really cares about patient care and who's not and who's up for a bit of an adventure, I guess. You'll learn things that you never thought you would, and you'll come back enthused and energetic to do your best for your NHS patients. And it's not just for clinicians, it really is for anyone who works in the NHS, and because we're all leaders in our workplace.